Hello everybody, I'm Dr. Vikram Maskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video. In this video, we're going to be talking about shoulder pain home remedies. So you've got pain in your shoulder. The pain started on its own or it started after an injury. That's very important to make this distinction. Pains that start on their own are because of inherent diseases in the body. And pains that start after injury are trauma related. That means something could be broken inside. Pains that start on their own, you've got a little more time to go to a doctor and get it addressed. However, pains that have started after an injury should be evaluated quickly. Whatever it is, if the pain has started, first emergency treatment is rest to that part. Do not move it, because the more you move it, the more pain is going to increase at that moment. Immobilize. So there's stuff like a sling or an arm pouch that you could use to keep that part secure till the time you get medical attention. Compression, stuff like crepe bandages, etc. help. Elevation and ice packs. So elevation is to keep that part a little elevated, and ice packs around that particular part help. So this will give you immediate relief. Apart from that, there's some over-the-counter anti-inflammatory medicines that you can get. That means you don't need a prescription for, which you could go into any medical store and pick up. Take them, it'll make you feel better. If it is injury related, please go to a doctor immediately, a specialist like me who can evaluate you, who can check you, get some tests done and be sure what's there. If it started gradually, you're doing some work, pain started, which has been increasing, then you can try some of these home remedies. As I told you, the RICE protocol, rest, ice, compression, elevation. Apart from that, gentle movement of your shoulder. So even if there's pain, it's important to preserve movement so that it doesn't get stiff, right? So how will you preserve movement? You'll preserve by gently moving that part within the realms of pain, right? Once you've done that for some time, your pain is reduced over a few days, then you can move on to strengthening exercises because muscles get weak. Easy way of movement is something called pendulum exercises. That means leave your shoulders loose and move your arms backward and forward for them to get some movement. You could also use some of these anti-inflammatory oils, etc., which have eucalyptus in them. So you get these balms, these sprays, they help. They act as counter irritants. What they do is they provide a little bit of coldness here. You think about the cold, forget about the pain, but gives you relief at the end of it. Gentle massage of the muscles around the shoulder help. Very gentle with some oils. They could do the job for you. Something called a tennis ball massage. You could take a tennis ball and then gently rub it over the muscles around these areas. They help in alleviating the pain. What could be the cause of these pains? So if it's injury related, it could be a rotator cuff injury. That means the tendons of your shoulder get torn. These are ropes that move your shoulder joint. They're continuation of the muscles at the back of your shoulder that come and attach onto the ball of the shoulder. They can tear, they can get inflamed. When they get inflamed, they can touch the bone above them. That's called impingement. It could be a fracture. Your bone could have broken. It's more dramatic, a lot more pain, a lot more swelling, a lot of bruising. It could be a dislocation. The shoulder joint may just come out. The ball may come out of the socket. You'd feel that your shoulder looks different. It pains a lot. Please seek attention quickly. It could be a ongoing process in your body which hasn't happened because of any injury. It could be overuse. That means you did some excessive exercise, the muscles are hurting. It could be a muscle strain. It could become something called a frozen shoulder. That means your shoulder gets unusually tight. How does it get unusually tight? This is an ongoing process in your body, more common in diabetics, divided into 3 phases: freezing, frozen, thawing. Why does it happen? We don't know. But if we take 10 people, 7 are diabetics. In the freezing phase, gradually the shoulder is painful, gets stiffer, stiffer, stiffer. First 2 months, 2 to 4 months, it remains stiff. 4 to 6 months, and about 70 to 80% people, they get back movement. So, of course, in them, you can try to do some self-home remedies with heat packs, anti-inflammatory medicines, and gentle movements. It could also be arthritis in your shoulder. So, in arthritis, there will be pain, stiffness, much like the frozen shoulder, but it doesn't go over a period of time. You could hear some funny noises, grating, etc. Going to a specialist will help you seek treatment and get the right treatment for the same. However, do not neglect your shoulder pain. Listen to your body. Pain is the language of the body. It's the way the body talks to you. You listen to it, get to your specialist, but these are certain things you can do at home to get a little better before you can meet your doctor. So when do you decide to see your doctor? You see your doctor when the pain is not getting better. The pain is severe. That means you feel that it's beyond what you've normally experienced, or the amount you can bear. If you've had an injury, definitely please see a doctor immediately. Number 3, you're not able to lift your arm on your own, right? The other hand can lift it up. Please see a doctor quickly. If you feel that the shape of your shoulder joint has changed, your shoulder doesn't seem to be in place, please see a doctor immediately. I hope you've understood a lot about shoulder remedies, home remedies that you could do for your shoulder pain. If you like my channel, please like and subscribe to it, and please follow me on Instagram. Thank you.